Hello and welcome to Medical Bulletin. This is me, Nana, with you. Today's headlines. Philippines confirms second MERS case in passenger from Dubai. Hundreds given urgent first aid at Saudi's Grand Mosque this Ramadan. New chemotherapy light technique discovered. More than 100 eateries fined, breaking RAC health news. Too much exposure to TV can disrupt child's cognitive growth. Test your blood for healthy babies. WHO lays out plan for financing new global health call to ensure healthy lives and promote well-being for all at all ages. WHO urges governments to step up tax on tobacco and tobacco products. Now, the news in detail. Philippines confirms second MERS case in passenger from Dubai.
The Philippines confirmed a second case of the deadly Middle East respiratory syndrome coronavirus on Monday in a man who showed symptoms after arriving in Manila last month from Dubai. The 36-year-old was admitted to hospital on Saturday and was under observation, Health Ministry spokesman Lyndon Lisu said. Adding contact tracing was now underway to prevent the spread of the disease. The man had also traveled to Saudi Arabia, the spokesman said. His condition was improving and there was no known transmission so far.
Hundreds given urgent first aid at Saudi's Grand Mosque this Ramadan.
Saudi authorities have reported to have provided first aid to more than 300 Umrah pilgrims that have traveled to the Grand Mosque during the first half of Ramadan. The pilgrims were suffering from exhaustion or fainting after they arrived at the mosque.
New chemotherapy light technique discovered.
Severe side effects from chemotherapeutic drugs have always been a major concern for doctors. Researchers now have successfully pioneered a new technique that utilizes light to active chemotherapy drugs in specific cells, increasing the effectiveness of cancer therapies. The team describes its finding in the journal Cell. The research is co-authored by Oliver Thorn-Sechol, PhD, and Professor Dick Turner, both from the Ludwig Maximilians University, Munich, Germany.
More than 100 eateries fined, breaking RAC health news.
The Public Health and Environment Department in Ras Al Khaimah Municipality has fined 122 food establishments for breaking public health and safety laws. The department inspected 837 food establishments since the start of Ramadan to ensure their compliance with rules and regulations. 17 other establishments were issued warnings. The department said it would intensify inspection rounds throughout the day to various food establishments so as to ensure they do not infringe rules and requirements they were presented with and so as to preserve the health of consumers.
Too much exposure to TV can disrupt child's cognitive growth.
Expert at parenting program says too much exposure to television, computer and digital devices can disrupt a child's cognitive growth and may delay his or her language skills. Dr. Kyle Pruitt, clinical professor in child psychiatry and nursing, Child Study Center at Yale University, said the increasing rate of obesity in youngsters is directly proportional to the increased screen time. Dr. Kyle Pruitt said he does not recommend screen time for children under 2 years. This is because children's interaction with TVs, computers, tablets and smartphones will upset their learning skills, result in the lack of focus and attention and lack of interest in playing with other children, thereby affecting their social skills. Dr. Pruitt was among the number of experts in early childhood development holding parenting talks in Abu Dhabi and Al Ain as part of parenting program hosted by the Salama bin Hamdan Al Nahyan Foundation in collaboration with Yale University. Dr. Kyle Pruitt said he does not recommend screen time for children under 2 years. This is because children's interaction with TVs, computers, tablets and smartphones will upset their learning skills, result in lack of focus and attention and lack of interest in playing with other children, thereby affecting social skills. Dr. Pert was among the number of experts in early childhood development holding parenting talks in Abu Dhabi and Alain as part of parenting program hosted by the Salama bin Hamdan Al Nahyan Foundation in collaboration with Yale University.
Test your blood for healthy babies.
Consanguinity is a deeply rooted social trend among one-fifth of the world population, mostly residing in the Middle East, West Asia and North Africa, as well as among immigrants from these communities now residing in North America, Europe and Australia. Marriage between people having the same ancestry or descent is a norm in almost every culture. Though no side effects are seen to the social fabric by such tradition, scientists say that statistics are stark for the offspring of such unions. 75 out of every 1,000 live births in UAE result in a birth defect and an estimated 6% of the total births worldwide. That is, 7.9 million children are born with a serious birth defect and these defects can vary in lethality. For those who survive the disorders, it can cause lifelong mental, physical, auditory or visual disability. But experts suggest that many of these birth defects can be avoided by preconception and premarital counseling followed by genetic testing.
WHO lays out plan for financing new global health call to ensure healthy lives and promote well-being for all at all ages.
WHO is urging countries to move towards universal health coverage and to scale up international investment in catalytic development funding. The call comes as world leaders travel to the third UN Financing for Development conference in Addis Ababa to discuss ways to pay for the new Sustainable Development Goals to be launched in the New York in September 2015. The best way to assure meaningful progress towards the new global health goal is for countries to move closer to universal health coverage, says Dr. Margaret Chan, WHO Director General.
WHO urges governments to step up tax on tobacco and tobacco products.
Too few governments levy appropriate levels of tax on cigarettes and other tobacco products. They therefore miss out on a proven, low-cost measure to curb demand for tobacco, saves lives and generate funds for stronger health services.
So that's it for today. Take good care of your health.